First, I'm going to review the patient's medical record. I would check their code status in the chart as well as any allergies. And then I would gather my supplies and wash my hands and then go introduce myself to the patient while providing privacy, which now I am going to demonstrate washing my hands. And also, normally I would cover up my tattoos, but I do not have band-aids, so we're just going to pretend you don't see these. Making sure to wash my hands for 20 seconds at least, 20 to 30 seconds. Now I'm going to apply on clean gloves. Okay, now that I have gathered all of my supplies, I am going to go introduce myself to our lovely patient. And then I would provide privacy. Okay. To provide privacy, hi, my name is Kaylin. I'm a student nurse. I'm going to perform a physical assessment on you if that's okay.
Alright.
Okay, can you tell me your name and date of birth?
Brandon Tebow, August 12th, 93.
Okay, great. I'm going to confirm that with your ID band. Okay, that's great. I checked the vital signs in your chart, and they were all normal, so that's a good sign. Are you feeling okay today?
Yes.
Okay. Okay, do you have any allergies as well, or anything?
No.
Okay, do you happen to know your height and weight?
5'10", 145 pounds.
Okay. Are you in any pain?
I'm not.
Okay, can you tell me where you're at right now and why you are here?
I'm at the hospital. I'm going to have some tests done.
Okay, can you tell me what today's date is?
March 6th.
Yep. Do you know what time it is roughly?
5 o'clock.
Okay, that's great. I'm going to check his hygiene status, which he is well groomed and clean, so that's great. Now I'm going to start my physical assessment from head down, starting with the head. Could you lean forward for me just a little bit? There we go. Thank you. Okay, now I'm going to start with the head, and I'm just going to generally inspect it before I start to palpate. His hair, thinness, and thickness looks good for his age. Now I'm going to palpate the head and skull, noting for any type of shape or symmetry or masses that may be present, and there are none. Okay, any pain?
No.
Alright. Now I'm going to inspect his face. Can you elevate your eyebrows for me? Okay. Can you frown for me? Now can you smile for me with your teeth? Okay, great. His eyelashes seem to be normal in length, which is good. Now I'm going to inspect his eye, first starting with the sclera. And they are white, so that's good. No drainage or yellowness present in his eyes. Now I'm going to make sure that his eyes are equal and reactive to light. Okay, so they are. And now I'm going to check for accommodation. So if you could look right here for me, I'm just going to bring this to the tip of your nose. Okay, I'm going to do it one more time. Okay, and accommodation is present. Now I am going to inspect the nose. Could you tilt your head up for me just a little bit? Thank you. I'm going to check for any flaring, nasal discharge, bumps or swelling, which there's none present. The nose is clean and normal, which is good. Now, are you having any pain in there?
I'm not.
Okay, and throughout the duration of this procedure, just let me know if you do feel any type of pain or uncomfortable at all. Now, could you please close your mouth for me and place one hand on one nostril and blow out through the opposite? And now do that with the other one. Okay, they're both equal pressure, so that's good. Now, I'm going to inspect your ear, noting the same things. I'm going to make sure that there's no redness, drainage, or edema present in that ear, which there's not. Now I'm going to do the same thing with this ear, which there's not. Now I'm going to palpate both ears and check for any deformities. And the patient has normal hearing, which is great. Now I'm going to inspect his mouth for skin integrity, dryness, and color. So could you open your mouth for me? Okay, I'm going to inspect the inside of his mouth. Also checking cavities or dentures, or I'm going to inspect the palates and the gums. There's no swelling, no bleeding, everything is intact, so that's great. Now I am going to we're going to move on from this, and I'm going to do the cardiopulmonary inspection. At first, I just want to check the structure of your trachea. So if you could, again, tilt your head up, and it's midline, which is great. Now I'm going to palpate the chest, making sure there's no bumps, which there's not. Everything is in line. I'm going to palpate the back now. All right, everything is in line. Now I am going to assess your breathing rate and rhythm. So just breathe normally for me, just for a few seconds. Okay, the breathing is normal, the rate and rhythm are normal as well. So now I'm going to listen to your heart, and then we're going to assess your lungs, okay? All right, I'm going to auscultate the heart sounds in all 4 heart valves for at least 10 seconds each. Second position. Third position. Fourth position and final position. And now, in this same position, I'm going to listen for the heart rate for a full minute. All right, your heart sounds great. Now I'm going to listen to your lungs. Just breathe normal, okay? Second position, third position, fourth position, fifth position, Sixth position. Now I'm going to listen from the back. You can just lean forward for me for a little bit. I'm going to check in 8 places going all the way down the length of the lungs. First position. Second position. Third position. Fourth position. Fifth position. Sixth position. Seventh position. Eighth position. Now I'm going to listen to the lungs from the lateral position. If you could just lift your arms up just for a little bit. Okay. Now I'm going to listen from the other side. Okay, your lungs sound great too as well. Now I'm going to palpate the carotid arteries, so one at a time. So if you could turn your head that way for me. I'll locate the carotid artery, which is strong. Okay, now can you turn this way for me? I'm going to do the same, just with this carotid artery. Okay, you have very strong carotid artery pulses. Now I'm going to check the rest of the pulses, making sure I do them together so I can assess for them being equal. Okay, I'm going to first assess the radial pulses. They are both strong and equal. Now I'm going to check the brachial pulses, which are located near the elbow, the bend of the elbow. Alright, those are equal. Now I'm going to check the popliteal, which is behind the knee. So make sure you can see. Okay, right there. That's good. Okay, yours are strong and equal as well. Now I'm going to check the femoral while we're right here. Alright, you have strong femoral pulses as well. Now I'm going to check the posterior tibial. Alright, those are strong. I'm also going to check the dorsalis pedis pulses. Those are equal as well. Okay, now I'm going to assess the body and the skin for color and any swelling and perfusion. So can you sit up for me? Okay, I'm going to check for capillary refill by pinching the fingernails, and they go back immediately. They blanch about half a second and go back, which is a great indicator of perfusion. Great. Now I'm going to assess, I'm going to do the skin turner, which it immediately goes back, which is a great indicator for hydration status. Okay, and the skin is of normal color. There's no edema, there's no marks, general marks on the skin or any scars, which is great. Now we're going to move on to the abdomen, so if you could lay back for me and lift up your shirt. Make sure you can see. Alright. Now I'm just going to do a general inspection of the abdomen. I'm going to make sure there's no scars or lesions or masses. There's no distension, which there's not. Now I'm going to listen for bowel sounds, making sure I listen in all 4 quadrants. Alright, first quadrant right here. I'm going to make sure I do this as well for at least 10 seconds on each quadrant. Move on to the second quadrant, second upper quadrant. Now I'm going to move to the lower quadrant. The last quadrant. Okay, vowel sounds are present in all 4 quadrants, which is great. Now I'm going to palpate the abdomen. Okay, now the abdomen there's no distension or anything. It's normal. Now I'm going to palpate the bladder, which is not distended or anything. Which is great. And now at this point, I would verbalize you can put your shirt down. I'm going to verbalize that I would perform a general assessment of the peri area and any peri care that needed to be done, checking for any drainage, discharge, redness, edema, lesions, and I would notify that in the patient's chart and to the provider. But for the purposes of this video, I'm not actually going to perform that part of the assessment. Now, okay, you can sit up for me. Just go ahead and move that back. Now we already assessed your skin. I'm just going to do another general intake of your skin assessment. There's no scars or wounds. Now I'm going to do a general inspection of the entire skin and checking for any scars, lesions, marks, redness, edema, in which there is none. Everything, all the skin is intact and there's no scars or swelling present. And are you in any pain?
No.
Anywhere in your body is in pain?
No.
Okay, great. Now I'm just going to do a general inspection of all the joints. So can you just let me see your elbow? Okay, there's no redness, no swelling. The joints move at ease. Now I'm going to do the same to the knees. Lift up. Bring that to you. There's no redness, no swelling, no edema. Okay, the joints move at ease as well. Now I'm going to inspect his spine. Could you stand up for me and touch your toes? Okay, the spine is aligned and even. Okay, any pain?
No.
Okay, you can sit back down. Now, I'm going to inspect the strength. So, could you, let me see, okay. Could you turn your head for me towards the glove? Okay. I'm going to do the same thing. I'll turn your head towards the glove. Okay, the patient has good strength. Okay, now can you sit up toward like the edge of the, okay. Now I'm going to inspect your shoulders. Could you, shrug up. Shrug up one more time. Okay, any pain?
No.
Okay, great. Now I'm going to, could you squeeze my hands for me? Great. Now I'm assessing he has good strength. I'll do this. Press down. Okay. Now press up. Okay. Now I'm going to assess your feet. Making sure. Assess your feet. Okay. Could you again push down? Assessing for strength. Now push up. Push up against mine. Okay, great. Now push down. Okay, now push up. Okay, he has good strength in all of his extremities. That's great. Now, are you good? Are you in any pain or anything?
No.
Alright, now we're going to assess just range of motion. Alright, I'm going to wash my hands and put on new gloves. Alright, can you please tilt your head backwards for me and forwards? Can you do side to side for me? Okay, any pain there?
No.
Alright, you have great motion in your head and neck. Now we're gonna, we already assessed the spine when we had him touch his toes. Now we're gonna do the upper body. Can you extend your arms for me like this? Now bring them to you. Okay, can you make a movement like this? Extend. Okay, he has full flexion and full extension, which indicates good upper body range of motion. Now we're going to do the lower body. Could you stand up for me? Could you lift one leg like this? Okay, now lift the other leg. Okay, now can you sit back down for me? Could you now lift up your foot? Okay, now the other foot. Okay, you have great range of motion in your both lower and upper body extremities. Now for to do more specific, could you do this with your wrist? Can you do like this? Okay, now can you take your thumb and touch your pinky and then touch every finger and then go backwards? Yeah, that's great. All right, now I'm going to assess your gait. So if you could, stand up and from heel to toe, walk 4 steps towards me and then turn around and walk 4 steps the other direction. Okay, his gait is aligned. There's no balance issues. Okay, you can have a seat. Okay, now this completes the assessment. I'm going to remove my gloves and wash my hands, but before I leave the patient's room, is there anything I can get for you? Are you comfortable? Okay, the provider will be in here to check on you in a little bit. I'm going to go and document my assessment information into the patient's chart, and then I would document everything that I needed, make sure the patient had everything that he needed to instill safety, and then I would notify the healthcare provider of the results.